I first met Alan at World actually about 7 or 8 years ago now. And I was immediately struck by his practical approach.
Alan is just one of the most dedicated, tenacious advocates I have ever met. He is a carpenter by trade and has really become an honorary MD PhD as he has learned this field inside and out, and not only partners with us, but many times has led us.
He is very good at coming up with a plan to approach a problem and to find all the tools and pieces necessary to build a solution. And that's the approach he took to MSD.
Again, he's this unusual parent with a sick kid who is very engaged at all levels, fundraising, what's happening with treatment developments, participating in grant writing, and listening to our talks and ideas about how to treat this disease.
One of his special talents is bringing together people across disciplines and introducing people and making connections.
You know, all of his free time when he's not working is working on helping move this along.
I think one of Alan's biggest accomplishments has been reaching out to the community around the world and partnering with organizations, for example, with Amber Olson here in the United States, to really try to meet the needs of MSD patients everywhere and to come up with a unified, logical, scientific strategy to move the field forward.
I think Alan's contributions have been to keep people aware of this disease and to help get selected by NIH for a gene therapy trial going forward.
Something that comes into my mind when I think about Alan, what he did for MSD. It's like he put MSD. He brought it on the big stages. And it's typically that he said, okay, this is MSD. It's not like the ultra rare, neglected, forgotten disease any longer.
He wanted to know from early on what tools were needed, whether it be animal models or cell models, who needed to be part of the team in order to approach this goal or tackle this challenge. And he really assembled this group internationally, including many people I'm sure sitting at the audience at World, to help him work towards his goal of developing a therapy for MSD, not only for his child, but really for the community as a whole.
It has really been an honor to be part of this process and be one of the people he has pulled into the fold.
You embarked on a journey and started a project. It's still not finished and still needs fixing, and we're happy to be part of this for the next couple of years to come until it's really done.
Alan, I'm really ecstatic that you got this award. You're the best of people I can think of. We love you, and what you do is very important, scientifically and socially, and we will never forget you.
Very good. Alan, on behalf of the WORLDSymposium and all the people you've helped, thank you for your diligence, your commitment, your good heart and your mind, and what you've been doing for people. Congratulations.
Okay. Thank you. Wow, it would have been easier to speak before watching this, but thank you for this. A big thank you to the organisers for selecting me and for recognising MSD, especially being so ultra rare. So when my son was diagnosed with MSD in late 2014, I can tell you that the world was a very lonely place, because back then there were very few known patients worldwide. When I decided to create a patient organisation and support research, I had to remain grounded, because there was a really high chance that my son might not benefit in his lifetime with what we were about to do. At the beginning, I promised myself two core things: that I would give it absolutely everything to succeed, and the second, that I would never, ever give up. I could not accept this award today without acknowledging the people that have joined me on this journey. This award is a win for the MSD patient community, and this includes Amber Olson, founder of United MSD Foundation in Mississippi, Fundación Cura MSD in Argentina, Cura MSD in Spain, Strengthen in Miami, and Grant Us Grace in Missouri. And also all the families around the world that have a child affected by MSD, and especially those that have been involved with research. For me, this conference has been a gilt-edged opportunity to meet so many of the world's experts and to promote MSD research. This gave the opportunity to put MSD research on the map. And today, there is one platform presentation on MSD by V. Pham from Children's Hospital of Philadelphia, which is an ex vivo gene therapy approach. And there are also 6 MSD posters being presented this week. This would be been an absolute dream when we started. The people that I must say a special thank you to are Amber Olson and the United MSD Foundation, Laura Adang and Emily Yu at CHOP, Lars Tawa and his colleagues at UMG Germany, Rebecca Aarons-Nicholas and her lab colleagues at CHOP, Stephen Gray and Rachel Bailey at UT Southwestern, Kat Lutz and Max Pressa at the Jackson Laboratory, Michael Gelb and Xinying Hong, and also Marcia Pasquale at ARUP. Thanks to our Scientific Advisory Board for support. 2 of them are here, Tim Cox and Elsa Shapiro. Thank you to all the scientists that peer-reviewed research proposals for me over the years. Without all of you, it would not have been possible to make such a great impact on MSD research. Because of this community, funding has been secured for 2 MSD clinical trials. One has EU funding for a repurposing trial, and the other has NIH funding via the Bespoke Gene Therapy Consortium. This would have been a dream when we started. Despite the truly incredible success of the MSD community, we will need help on the next steps of our journey. We need patience, we need an early diagnosis, and we need all of you to never forget MSD. And the last thank yous go to my board of directors, Linda Bryan, Linda Darby, Andrew Patterson, and all of my family for the support, and my sister, Suzanne, for helping me many times to bring Dylan to Germany to visit Lars Tawa's hospital at UMG. And lastly, to my wife, that is always taking great care of Dylan every day, but especially when I'm running around the world, trying to give it everything to try to defeat MSD. Thank you, Michelle. You have made my efforts possible. And the last thing I'd like to do, might be a little bit of fun for the people that are in the room. If I can ask you a question, you'll be able to answer this very quickly. If I've ever spoken to any of you about MSD, maybe you've given a bit of advice or pointed an arrow somewhere, or maybe you've also spoken to the other MSD patient foundations that come to this conference. If you would take a second, I'm not going to rope you into anything, just raise your hand. I just want to try and see. Yeah, okay.
Pretty much got everybody.
Yeah. So what I want to thank all of you. You educated me, you helped in some way, you helped the MSD family foundations that come to this conference, and you made a profound difference. Thank you.
Thank you again, Alan. Thank you very much.